I have hand sanitizer.
Be considerate of others is the general rule. I think it's a kindergarten rule, right? A lot of kindergarten rules still apply to us as adults. This is one of them. Another kindergarten rule is wash your hands.
Sing happy
Keep your
birthday.
fingers out of your nose. Don't touch other people. All of these things apply right now. The kindergarten rules, very important. Cyrus, do you have other report for us?
No, I think we do have some other specifics that we were hoping to talk to you about, but I think it was as part of our education, the Mayor Sander, we were thinking if you could give us high-level perspective from a scientific standpoint, because this is a discussion that happens and part of the video that you will be helping us to distribute to the community, but there is a lot of misinformation out there.
Sure. I don't have anything planned at this point, so it's going to be sort of off the cuff, but I can sort of do what I did for that meeting earlier today
That'd be great.
that Garrett referenced. You're going to take notes, great. So we're faced with a worldwide outbreak of a coronavirus. Coronaviruses have been known a long time. This is a new version of it. There's nothing particularly different or remarkable or shocking about it compared to other coronaviruses. It seems in line with those coronaviruses. Coronaviruses in humans cause colds. So it's a cold-like symptom, can lead to bronchitis in some cases, but they're not really super dangerous viruses as a species, as a group. This virus started in Wuhan, China. They made attempts to control it. They were not able to control it. It probably spreads pretty easily from person to person based on its characteristics. There are a whole bunch of numbers that can be assigned to it in sort of an equation that describes how an epidemic occurs or how a virus spreads. And the hard part for us right now is we don't have answers to a lot of those variables, what they are. For example, how readily does it spread from one person to another? A virus like measles spreads extremely easily. One person with measles walks in this room, it's airborne, you can easily get it to a whole bunch of people in the room. One person with influenza walks in this room, it also spreads, but it doesn't spread quite as well. So that person doesn't tend to infect as many people. We don't know where on that scale this virus is yet, because we just don't have enough data. You gotta have a lot of data from different sites around the world to figure those sorts of things out, how dangerous it really is. We do have some data from China, from their version of the CDC. Unfortunately, a lot of what's been talked about in mass media is sounding definitive, and we all want black and white answers to these questions. But the reality is the answers to the questions that everyone wants to ask right now, there is no solid answer. How dangerous is this for someone who's 80 years old and has a certain lung condition? We don't know. We won't know probably for years until the analysis has been done of what happened with this particular virus. So all we have are estimates. But because our population wants black and white answers, people are creating them. And so there have been some scary numbers put out there. And don't let me knock those numbers. Some of those numbers could be accurate. It's not likely that this is that extreme of a situation, but the range of numbers you've heard out there for death rate it's possible. It's possible it's very low. It's possible it's moderate and scary. So we don't know. And unfortunately, a lot of the very technical, precise questions, that's the answer we don't know. And so the best response is to just be smart about what you do. And you've heard the reactions to, or the comments today from the CDC and the president about things to do, things not to do. If you're sick, stay home. If you're in the vulnerable identified population, having immunocompromised condition of some kind, if you've got lung condition, if you're a senior citizen and it's an increasing risk from age 60 to 80 and on up, the risk keeps going up as you age and all the numbers we've seen. Stay away from people who are sick and potentially isolate yourself in your home to the greatest extent you can, just to knock down your risk. So, as I started this, we have a virus that's spreading, and the question is, what do you do about it? There are a variety of things you can do. One, the first step is you try to contain it. Trying to contain it, that means you identify everyone who has it, you trace all of their contacts, you tell those people to lock down in place. Don't allow the virus to spread to more people. Eventually, the virus would burn itself out, then it wouldn't have anyone to go to because everyone's separated and isolated and contained. That probably failed in excess of a month ago with respect to the world. China made a kind of heroic effort, I think, to try to contain it. It was unlikely when you had that many cases in China you could truly contain it. When it got to South Korea, that was a very big outbreak with multiple original sources. That one also potentially, maybe, I was still personally hoping that was containable. That one sort of got too big. When the large outbreak happened in Italy, clearly it was out, and we were dealing with a pandemic as opposed to something that could be contained and restricted. I think a lot of people here are still thinking about containment. They're thinking we can identify all the cases, those people stay home, and we'll stop this thing. And I don't think that is very likely. What is more likely is that we're going to have to go through a wave of this epidemic, and it will take some time for us to work through that wave. And I can describe this sort of as a mountain. You have a few people that get infected, and a few more, and a few more, and a few more, and then it becomes an exponential growth. And humans are not very good at understanding what exponential growth is. We think more linearly. So this is not a line on a graph. This is a curve that accelerates up rapidly, like with a doubling time of, days or hours, depending on what you're dealing with. But so there's this exponential growth. And right now, we're way down on the low end of that sort of a curve. The question is, how big does it get? At its peak, how many people are sick and really sick with this disease? And so the measures you're talking about now, social distancing, people staying home, the lockdown they're talking about in the Bay Area, is really about taking that epidemic mountain, let's just call it a mountain, and trying to flatten it so you don't have as many people sick at the same time. And that's important because if you have a lot of people sick at the same time, you overwhelm the number of health facilities that your health facilities can accommodate. So if you have so many sick people who are in a hospital who need an ICU bed or need a respirator, there's a limited number. Horrible decisions will have to be made about who gets care and who doesn't, and that's what we're trying to avoid, those horrible decisions. And because we don't know a lot of the fundamental basis of how this virus spreads or how big it might get, caution is certainly warranted. So the attempt is to take that mountain and sort of smash it down to a hill. You probably have fewer cases when you do that. You certainly save some people who are not going to be exposed to it because of all the measures you're taking, trying to flatten that curve. So rather than have that big mountain of epidemic, you sort of have a hill of epidemic. One consequence of that appears to be, though, that you broaden how long it lasts. So rather than get it over with in an epidemic, you probably lengthen the amount of time that infection is around as you're continually trying to contain it, not strictly contain it, but moderate how it spreads, mitigate how it spreads through the community. So we've had school closure announcements now for 2 or 3 weeks, depending on the district. It's now we're talking the word indefinite is going out there. I suggest that based on the numbers we've seen so far, we're probably talking, and I think the president mentioned, CDC mentioned this publicly today, 8 weeks, 10 weeks, something in that range is probably the normal course. And we don't really know what the effect of this social distancing effort is. As we flatten that, we don't really know how long it goes. Could be less than that, could be more than that, but something sort of on that time frame, I think, is what people need to think about. And so as we continue the social distancing, you're going to see, hopefully, some state-level actions or some federal-level actions as opposed to local jurisdictions taking actions. So the thing I saw today that concerned me a little bit in the Bay Area was this, I'm not sure how they're describing it. I think they're calling it a total lockdown. Shelter in place, lockdown, stay where you are, don't go to work, shut down all businesses except for critical core businesses that I'm not sure how you're going to define. That sort of an effort may have its place, but I'm not certain of its timing. There might be some epidemic math that suggests now is the time for that. I just haven't seen that. And so we as a region are probably going to be facing that question, or certainly our state is going to be facing that question. How many measures do you take? The problem with epidemics like this is you catch the virus and then you get sick, and there's a time period here. Maybe it's 2 days, maybe it's 14 days, maybe it's more than 14 days. We think it's about 14, somewhere in this time frame. Maybe 8 is when symptoms start showing up, but certainly by 14 you probably have it. So there's a lag between what you're doing and what you're seeing. So everything we're seeing is sort of like who was infected 2 weeks ago. That's what we're seeing now. 2 weeks from now, we'll be seeing the results of who's infected today. So you have to make decisions in advance of knowing what's actually going on because of that delay of getting a virus and showing symptoms of it. It makes this business very difficult, messy, and filled with guesswork. And the reality is you just have to act with great caution and with the best information you have available. Does that cover sort of what you were hoping for? People ask me about a vaccine all the time. A vaccine is probably a 12-month to 18-month process. It's very complicated getting a vaccine approved. I think Human trials started on one today. There'll be several different phases of human trials. The FDA will probably expedite the process for approving it, but that's not going to deal with our next 2 months or next 3 months or next 6 months, whatever this is, that we're currently going through. There are no antiviral drugs identified as of now. There's hope about a couple, but that will also take some time. And in both cases,
Is that faster than vaccines?
it could be, depending on which antiviral worked. But we have a very limited number of them in the arsenal, and they are generally extremely targeted towards certain viruses. We don't have any that affect this family. So it'd be a matter of luck to have something that was designed for something else that works for this. Now, I'm sure a lot of things are being tried. There are a lot of drugs under development. I'm sure everything's being thrown at this. I know in China they did it in a way that we can't, because they can do sort of human testing in a way that basically we can't in the United States. Maybe they will, show some results with something that we haven't seen yet.
Question about does anyone have the number of youth you have? What is youth? 65 or older is listed as older, and they're the ones who will have worse type of return, on this COVID-19, but the youth wouldn't. So we're talking about 1 or 2% of the people who would really be who would die from it possibly, but what about the others who are going to have it and then just like, someone would just have it like a cold and then they're back and they're done and then, so has that even been looked at yet in the state or in the counties?
It's the fatality rate. I'm hesitant to say numbers, but I'll repeat what's publicly out there. China looks like a 3.5% fatality rate. In South Korea, it looks like a 0.4% fatality rate. In both of those cases, there are all sorts of confounding factors. In China, 50% of men smoke. And so if you look at the death rate in China, it's 2 to 1 men to women as a result of that. Because of all the disease they accumulate from smoking, then hurts them when you're trying to treat them for this infection, makes them more likely to get pneumonia. So that's a confounding factor. That's not the case here. Medical care and standards in China are different from here. South Korea is different from here in the same way. And what we don't know is how many people are walking around with it and have almost no symptoms. And that is probably, you mentioned the youth, that's probably the situation for the youth. For them, odds are there's not a good biological mechanism that says kids simply don't get it. That doesn't make much sense. What's more likely is that they get it, they don't show symptoms. So they walk around, they'll share it, spread it, not knowing, of course, and people who are older will get it, have worse symptoms. People who are really older will have even worse symptoms. That tends to be the course of it. And it's probably more about the age of your immune system and other health conditions than anything else. As you get to be a senior citizen, your immune system just isn't quite as effective on average as people who are younger. And so that's probably why you're seeing that uptick. That and the accumulation of other physical ailments that may facilitate pneumonia.
Thank you.
But yeah, that percentage, don't buy or believe anything you hear yet. It's way too early to know what that number is because you don't know the denominator. In China's case, those numbers are largely people who are hospitalized. Of the people who are hospitalized, how many perished? It's not how many people have it.
Well,
That's an unknown.
Yeah, in China, they built hospitals in 2 weeks. I thought, gee,
And they still had
And then
to,
they fell down.
and they still had to use gymnasiums and public spaces, and their health system was overloaded with patients. That's what we're trying to avoid.
yeah.
Thank you, Mr. Mayor.
All right.
So this is
This
great.
is not medical advice. I'm not a physician. I'm a PhD, not an MD.
That's
Done
awesome, Maria.
Public
That's the kind of
policy
stuff.
and virology and little public health and a lot of medical research stuff. So if that's helpful to people, I'm glad. But it's just my opinion, and based on some facts, continue to look to the CDC, state authorities, county authorities for your best advice.
Thank you, Mr. Mayor. This is definitely helpful. I'm sure it's helpful for all of us.
Okay, thank you very much.
We have one additional speaker, and that is Gerald Langwell.
Gerald, welcome.
Mayor, Council, Gerald Langwell again. Is there any information on how long this virus remains viable on surfaces that it might come in contact with? I don't want my delivery boy sneezing on the pizza box and getting the virus.
It's an unknown, frankly. Those sorts of studies are always very difficult to do because of the widely varying conditions which occurs. Like if that pizza box sat out in the sun for a little while, that would give you one result. If it was placed in a refrigerator for a while, that would give you a different result. If it was a humid day, that's a third result. If it's a dry day, that's a fourth result. How hot was the pizza box when stuff landed on it? There's just so many variables that there's no easy answer to that. But this virus requires that it be in an aqueous environment. If it's left on its own and dries out somewhere, it'll be non-functional. And it's just the structure of the outside of the virus can't maintain itself in a non-aqueous environment. But an aqueous environment can be a microdropule, just tiny little bit of water around the virus. So under the right circumstances, it might last on a surface for a while. If there's a nice little groove and it wasn't too hot, and it can kind of sit in there and, cling water to its outside, it might survive day or two, something like that. Under normal conditions, you're probably talking more like hours rather than days.
Thank you.
But it's almost an impossible question to answer. Along with the seasonality of it, people are speculating that summer will come and it'll be too hot, and unfortunately, it's not nearly that simple. No viruses really work specifically that way. They all have cycles. We don't understand why. All of them have cycles. This one will probably have a cycle. Hopefully, it just goes away the way the original SARS did. But if that's not possible, then it could be just an added virus to the milieu of viruses that we live with. Maybe it's seasonal, maybe it's not. Don't know.